Tonight's video is kindly sponsored by Freecash. Freecash is an online platform where users from around the world can sign up for free and make money online by playing mobile games from different categories. How amazing is that? You simply pick an offer and game through Freecash, follow the instructions and start to play the game. I love the fact that I can play games and earn money at the same time. It is so easy to use and there are so many ways that you can earn money just by completing the simple tasks. There are so many different offers available and so many fab games. I like finding new games to play in my spare time. I'm currently enjoying Monopoly Go. I did a few in-app purchases to speed up my progress and I got cash back for that. If you'd like to try Freecash yourself, click the link in the description box below or scan my QR code and get a $5 bonus on your first offer started. Depending on your country, the interface may look slightly different, but the functionality is the same. Thanks to Freecash for sponsoring tonight's video. Hello, lovely. How are you? Not too bad. Alright, that's good. Yeah, I'm alright, thank you. I'm Dr. Nicola, one of the gynecologists here at the clinic. Nice to meet you. Alright, however, not necessarily in these circumstances, but, you know, I'm here to help and I'll do my best to get to the bottom of what's going on. Alright. You're welcome. So, I'm just going to check you in first, okay? Can you confirm your name, please? Thank you. Date of birth? Thank you. Okay, I don't have a contact number for you. Can I take it, please? Thank you. Excellent, thank you. And can I take an email so I can get your report to you? Thank you. And can you just confirm your address, please? Ah, okay. Excellent. So you are a new patient here. And you've got a doctor's referral. Have you been waiting long for an appointment? Ah, that's good. Lovely. Have you seen a gynecologist before? Okay. Lovely. Okay, do you know your height? And do you know what you weigh? I will check your weight a little bit later if that's okay, my lovely. Thank you. Okay, do you have any allergies? Okay. Okay, do you take any medication? Okay. And what's that for? And how many milligram? Okay. And what's that for? Okay. And anything else? Lovely. And is that all of your medication you take? Okay, lovely. So that is that all done for now. Okay, right. So now I'm going to get out my consultation form. Okay. Now are you nice and comfortable? Okay. So I'll pop your name on here. Can you remind me of your date of birth again? And how old are you? Okay, I'm just checking. Right, so this is not a long consultation form, but there is quite a few questions, but they're quite short, if you know what I mean. But I do need to ask you all these, it's essential. I need to know what's going on and things like that, okay? Alright, so first question, are you sexually active? Okay. So when did you start your periods, like originally? How old were you? Okay. Now currently, how long is your cycle? Okay. And would you say you are regular or irregular? Okay. Okay. Yeah, alright. Now, what about when you first started? Do you remember? I know it was some time ago, but were you quite regular or not? Yeah. And what happened over time? How has it changed? Yeah. Okay. Okay, that's fine. Yep. Okay. Right, currently, how heavy is your flow? Has it always been like that? When did you notice the change? Right. Okay. Were you doing anything in particular around that time? How was your life like, your stress and... Okay. Right, do you know when your last period was, please? Yes. Okay. Right. So, do you experience any bleeding during or after intercourse? Is that all the time or? Right. And do you experience pain during? What about afterwards? Okay. Right. When you have your period, do you get pain? I know it's a silly question, but do you experience discomfort and pains? Okay. Now, are your pains mild, moderate, which is severe? Okay, so how would you rate the pain out of 10? Okay. Yep. Okay. Has it always been that way? Yeah. Okay. Yeah, so it's kind of got worse and worse over time. Alright, thank you. Right, how many sexual partners have you had? Okay. Right, some of these questions may be a little bit triggering, so please be warned. It's only simple answer questions. Have you ever been pregnant? Do you have any children? If so, how many? Have you had any miscarriages? If so, how many? Any terminations? If so, how many? Any STDs? If so, how many and which? Okay. Are you currently using contraception? If so, what? Okay. Thank you very much. Okay, that's enough of the triggering questions, okay? Right, so now, what contraception have you used over the time? Yeah. Okay, which one? And how did you find it? Okay, so it affected your mental health. Okay. And what happened? Oh, wow, okay. I can see why you haven't been taking that. Okay, that's fine. And anything else? Okay, so you've had different ones. So you've had the different types of the pill, and none of them have agreed, okay? And you've had the, did you say the copper coil? Okay, and how did you find that? Yeah. Okay. Right. Right. When was your last smear test? Okay, so you can't remember. Have you had one, do you know? Okay. Right. Have you got a family history of any cancer in your family, such as breast cancer, ovarian cancer, cervical cancer, stuff like that? Anything reproductive? Okay. And who was that? Okay. Right. Okay, so estrogen, yeah. That's fine. That shouldn't be a problem. Okay. Now, I want to ask you about your symptoms. What brings you here today? Symptoms. So, severe pain during your period, okay. Yeah. And pain during and after intercourse, okay. And bleeding during and after intercourse. Okay, when you say that, is it really heavy? Is it little? Okay, so maybe a little bit of spotting. Okay, yeah. Okay, what about the pain? Okay. Okay, that makes sense. Okay, thank you. And you have discomfort most of the time, okay. And when you say discomfort, whereabouts? Yeah. Yeah, and you just can't settle, it's just not quite right. Yeah, okay. Now, when you get period pain, it's severe. And what kind of, how does it feel? I know it feels like period pain, but are you getting other pains as well? Okay. So what about outside of your period then? Can you describe that pain? Okay. So we're getting throbbing, squeezing, tightening pain, a dull ache, and it feels like contractions. All right. And which is the side or whereabouts? Okay, so it's all over, more on the left. Okay. We call it ovary ache. Okay. So is it a distinctive pain? You can like spot it a mile off. Okay. Yeah. So you've sort of got a mix of kind of pains going on, haven't you? You've got like the discomfort, but then you've got like period pains, but then you've got this other pain. Yeah, I know what you're trying to explain. Okay, how is that affecting your mood? Okay, so moody, low, anxious, sad. Okay, and how is it affecting your sleep? Yeah, okay, so you're struggling to sleep when you've got the pain, which is understandable. Okay, yeah. So it does keep you awake. Now, does this affect your daily life? I'm guessing it does. So it affects things like work, socialising and things like that. Yeah. Yeah, you can't be living like that. Yeah. So when this is happening, what happens? What are you doing? What are you taking? So hot water bottles, baths, walks, rest, sleep, pain relief, ibuprofen and things like that. Right. Okay. And are we having any relief or not? No. Okay. It's not really a relief, but you do it to just try and help. Yeah. Okay. The doctors give you some stronger pain relief, haven't they? How are you getting on with that? Okay. We could do with something a bit stronger, to be honest. Right. Any other symptoms? Are you getting a lot of discharge? If so, what is it like? Okay. Yeah. And any other symptoms that you've been experiencing? Okay, so leg pain, IBS, yeah. When was you diagnosed with that? Okay, so sometime. Now I know this might be a daft question. Is the pain similar to IBS or not? Okay, thank you. Yeah, you can definitely tell the difference there. Okay. Because sometimes we can get all sorts of things going on with our digestive system and causes all this type of symptoms and pains, but what you're describing is not that, so I have to ask one just to check. Okay, lovely. And I want to ask you about your symptoms that you get during period. So, what are your symptoms? Okay. Yeah, the pain, yeah. Heaviness. Sleepy. Lethargic. Bit of IBS sometimes, okay. Hot flushes. Yeah. Okay, that's fine. How long are your cycles? How many days are you on? Okay, so you find, are they getting longer? Okay, and how have you been on your last few periods? Okay, dizziness, nausea, upset just generally unwell. Okay. It sounds like you're going through hell. Yeah, we can't keep you like that. We've got to have a look and see what's going on. All right. Okay. Right, so done allergies, we've wrote those down, I wrote the meds down, that's fine. Height, we've done that. Weight, we've done that, but I would like you to check. Would you mind just standing on the scales for me, my love, so I can just an accurate reading. Thank you very much. Okay, that's good. Right, now can you tell me about any health issues? Mm-hmm. Mm-hmm. Yeah. Okay. Lovely. Thank you very much. Now, have you got a family history of anyone with reproductive issues? Not cancer, but just any issue. Okay, so not that you're aware of. Right, have you had any scans or anything done prior to coming to see me? Okay, so nothing. Alright, my lovely. Right, that is that done. The first appointment is always kind of asking lots of questions, you know. Yeah. Right, so let me just change the weight on there. Okay, right. Consultation complete. Okay. Right. Lovely. Now, I'm going to carry out some basic checks first, alright? Did you bring me a urine sample? Oh, wonderful. You can pop it on the table when you're ready, my love. Okay, so I'm going to start by checking your pulse and oxygen levels, okay? If I can have your index finger, that would be great. Okay. So you just keep nice and still. Just waiting for it to level out. There we go. Perfect. Okay, that's that. Let me just check your temperature. Just want to see if you've got a fever, okay? Sometimes we can have a little bit of a low fever and not necessarily got any symptoms. Or if I can pop it in your ear. That's perfectly fine. Okay. Okay, so that's your urine sample. I will check that a little bit later and I'll do some blood. So when do you last have a blood test, do you know? Okay, not to worry. Right. Let's check your blood pressure. Okay. Pop your arm on there for me. Thank you very much. Okay. Just put a little bit tight on that. Okay. It goes very tight, doesn't it? Wonderful. That's perfect. Okay. Okay, that's fine. Excellent. That's that. Okay. So, what I'm going to have to do is check your urine out now. Okay. Then I will feel around your tummy and I will possibly do an internal. Alright. And then I might send you for an ultrasound scan or something like that. Okay. Yeah, and I do want to take some bloods as well. So use those like that. Okay. So I'm going to just sort everything out and then we'll begin the checks, okay? Now I have everything, I can check everything out. Okay, so let's put my gloves on. Are you doing okay, my lovely? Yeah. Okay, so what's your diet like, my love? And what about your water intake? Okay. It's looking a little bit on the dehydrated side, okay. Is there any chance you could be pregnant, my love? Okay. Good. Okay, so wait a moment. Okay, my love. That's all perfectly fine. Yeah, that's good. Don't worry about that. Okay. Okay. I'm going to have a feel around your tummy. Okay, if you could just lift your top and just lower your bottom half so I can have a good feel around, okay? Thank you. Okay. Gloves are on. Now, am I alright to proceed? Okay, now when I'm doing this, I want you to tell me where it hurts, what kind of pain it is, and things like that, okay? Perfect. Ready? Alright. Okay, I'm going to go a bit deeper. Alright. Do really well. A bit more now. Alright, I'm sorry. Okay. Okay, now cough. And again. Okay. Okay. Okay, suck your tummy in. Okay. Okay, relax. Okay, tell me how far it goes. Yeah, okay. Okay. Alright. Now I can't feel any hernias or anything like that. I can't feel any obvious like swellings. However, your tummy overall is a little bit swollen. Is that normal? Okay. Yeah. Yeah, it's very low down, isn't it? Yes, all there, up to that bit there is all very swollen, but touching you I can't feel any lumps, bumps or anything like that, okay? Alright, my lovely. So, that's that. I am going to do an internal in a moment. I'm going to have a look, okay? And it's not very pleasant, but I would like to have a look, take a couple of swabs and also smear. Alright, my lovely. Okay, I know, but you'll be fine. Okay, we'll just do one step at a time. Okay, right, whilst I get everything prepped, if you could remove your bottom half for me and get yourself lay down and keep your legs like so, like that, and flop. Okay, I'll see you in a moment. Are you okay? Alright, so I'm going to have a look in the entrance first just to see if there's anything obvious there. Alright. Just need you to really breathe and just try to relax for as much as possible. Okay, let me have a look, my love. Okay. Am I alright to... Yeah, okay. Okay, that looks okay. I can't see any obvious things on the outside or anything like that. That looks healthy. Alright. Okay. So I'm going to pop in the speculum, okay. Okay, my love. Okay, try to open your legs and relax for me, okay? I'm going to pop in my fingers first. Okay, my lovely. Just breathe and sit. Okay, deep breaths, my love. Just feeling around, see if I can feel any lumps or bumps. Okay, feel a little bit of ridging there. Let's go a little bit deeper. Alright, my lovely, it's okay. Deep breaths. Alright. Okay, my love. Okay, right, I'm going to pop it in the speculum. You ready? Okay. That's it. Relax. Well done, my lovely. Okay. Alright. Okay. Let's get this light around. Yes. Okay. Okay. Keep nice and still for my lovely. Okay. So I'm just going to do the smear. Okay, deep breaths now. Deep breath. That's it. Well done. Well done. Excellent. Well done. Good. That was well done. Okay. Now I'm going to take another couple of swabs, my lovely. Not so deep this time, okay. That's it. Well done. And one more. Here we go. Well done, my lovely. Okay. Alright. That's done. Okay. Let me just... I can't see anything obvious in here, my love. Okay. Just going to open it a little bit more. Okay, it will feel a bit strange. That's it. Well done. Can you slightly cough? Gently. That's it. Stop there. Thank you. Okay, I'm going to remove this now, and out we go, my lovely. All right. Okay. Here is a cloth. I would like you to use that just to wipe yourself up, my lovely. Okay, and then you can get yourself dressed, and I'll see you in a moment. Okay. So inside was a little bit on the red side. There was a little bit of ridging as you went in, okay, but I couldn't see anything. There was a build-up of discharge, but I couldn't see any blood or any pus or anything like that, okay. I couldn't see any abnormal lumps or bumps or anything, my love, okay, which is good. Now that doesn't mean there's nothing going on though. Alright, so don't worry, I'm not just going to leave you there. I'm actually going to continue with some assessments and make sure, you know, we get all this sorted for you. Okay, are you feeling okay? You're in a bit of pain now? Okay, whereabouts? Okay. Okay. Okay, so I'm going to take some bloods now. I just need to page ultrasound department, okay. Okay, let's wait for them to get back to me as well. So I am going to do your bloods now, okay. I will send off as well. Okay, so This and that there. Great, we can get you down ultrasound in a moment. Some to your bloods first. I'm just going to take 3 of these, okay. So the ultrasound will be on top of your tummy and internally, my lovely. Okay. I know, I'm sorry. It's must and all though, my love, okay. Okay, can you do some pumping for me? How are you with blood normally? Are we okay? Okay. They've got a small needle anyway. I like to bring a small one because otherwise I end up getting a normal one and then I have to go and get somebody else involved. It's just too much. Okay. Lovely, let me have a feel. Okay. Just check the other side. Okay, this one's definitely better. Right, I'm going to try there, okay, which is wipe. Okay. Alright. Keep your hand nice first. Sharp scratch. And release. That's it. Well done. Perfect. Okay, if you can keep pressing down on that for me, my lovely, that would be great. We've got that one and that one look fine. That's good. Let me have a look. I'm going to pop that there and there, but if you can just hold on it a little bit for me, my love, that would be great. Thank you very much. Okay, so that is all that done. And then we've got coming in. Hi. Okay. Perfect. Lovely. Right, if you could go with this lovely gentleman. He will take you down to ultrasound, okay? And Becky will meet you there and she will carry out the ultrasound scan, okay? Alright. Dave. There you go. You go with Dave and he will make sure you get there safely and he will bring you back when you're done. Alright. It's going to be okay. All right, deep breaths. Okay, I'll see you in a little while. Coming in. Hi, come and take a seat. Thanks a lot. All right, cheers. How are you? You're not too bad. Okay. How was it? Uncomfortable? You in a bit of pain now? Alright, my love. I know. It had to be done. Just have a look. Okay, they said the report will be 5 minutes or so. Okay. Obviously when they do it, they have a good look round anyway, and then they just kind of do a little report for me, but they won't do anything in depth because obviously I'm here with you now. Okay, so that's all that done. Excellent. Right, so I'm going to have a look at your scan in a moment. Okay, but obviously I'm going to have to wait for the bloods and the swabs results and your smear test, okay? I will get the smear test as pushed through as a quicker, urgent rather than having to wait like normal, okay? Shove that through just because I need to know, I need to get the results in so I can see what's going on next, alright? And obviously the bloods, I've asked them if they could do them urgent as well. So all that was taken down while I was waiting for you. Okay. Aha. That should be the results. Let me have a look. Okay, so your images don't actually show us a great deal. Alright, we do think that one of the ovaries is slightly smaller than the other, okay, but it shouldn't be contributing to all these issues. Okay, my lovely. Yeah, we can't see any abnormalities, any shadowing or anything like that at all, but the ultrasounds are very basic, so we're going to have to do some further testing, I'm afraid. I would like you to have a CT scan, okay, and what we need to do is pop some dye into you and then we can do the CT scan. Alright, my lovely. Yeah. I don't want to do an MRI just yet. CT scans are fantastic for looking at this, but we may have to do a laparoscopy or something like that. Okay. Yeah. Right, let me see if I can get you in for a scan while you're here, my love. Okay, I can fit you in. Right, I'm going to have that slot. Okay, now I'm going to get, honestly, let's come and get you. You'll probably end up seeing Dave again. Okay, right, wait for them to turn up. Okay, so go and have your CT scan, alright, then they'll probably get you to wait in reception and then I can get you back in and I will see you. Okay, by then I'm hoping all the bloods are back. Okay, the swabs will be back as well, the main ones, but the smear might be a few days. Alright, be a little while for that, but there's no... Hi Dave, told you it would be Dave again. Lovely. CT. All right. Yeah. Do you have any questions? Are you sure? Okay. Well, I will see you a little bit later on. All right. All the best. Coming in. Ah, hello. You all right? Come and take a seat. Thank you. Right. How was that? Not too bad. Good. Are you feeling okay? Have they been looking after you out there? Good. Right, so I've had a look through everything, my lovely. Okay. So, the CT scan, to be honest, hasn't shown us a great deal. I know. But it does show us that the one ovary is definitely smaller than the other. And it does have lumps in it. Now, you haven't got polycystic ovaries, but there is something going on in that ovary. Now, I'm not saying it's anything serious, but, you know, there is lumps in there. Okay, other than that, we can't see really anything else. Not a lot is showing up on the images. So I feel like we need to do an MRI scan. It needs to be a lot more in depth. What's going on with your ovaries? It's not going to be causing you this problem. I think there's something else going on, something that's harder to see. All right. Which is why I'm thinking a laparoscopy would be really good for you. Have a look, see if you've got any adhesionologists or anything like that going on, any endometriosis, you know, scarring and things like that. All right, so, you know, I think it's best that I get you in for an MRI scan, and I don't know if you've got time today. I know you've had a lot done already today, but I can have a look for you. I can get you in, but you'll have to wait around for about half an hour. Would that be okay? All right. All right, okay. So that's all booked in. Now, let me just show you the bloods. So the bloods have all come back perfectly normal, my lovely. Okay. So nothing abnormal on there. You've are lacking a little bit of iron. It's a little on the lower side, but if you are heavy bleeding, that could be that. But other than that, you know, there's nothing really. Vitamin D is a little bit on the low side, but you know, that's pretty common anyway. But other than that, there's nothing that stands out to us on the bloods. Okay, smear test is going to be a little bit longer, I'm afraid, probably looking at a few days. Yeah, but I'm not really concerned about that, if I'm honest with you. I think there's something more deeper going on. So if you go and have this scan, and then I can find out what's going on. So in a moment, if you can go and relax in reception, okay? When they are ready for the scan, Dave will come and get you and take you over. Have the scan, then you'll have to go back and sit in the waiting room again, and then I can call you in. So you're going to be waiting around a little bit. Is that okay? I mean, I could always get you to go away and I can book an appointment and I can see you another time. You do want to wait. Okay, that's fine then. All right, but then we'll look after you out there. All right, okay. Well, I'll see you soon. Coming in. Hi, go and take a seat. Thank you. How are you? All right, okay. So, got the scan results. I've had a look through. Now, you have a huge mass of blood vessels wrapping your uterus, your whole of your pelvic area. It is very extreme. Yeah. So it's literally everywhere. Okay, it's not endometriosis, no, it is what we call pelvic congestion syndrome. All right, so basically everything is enlarged. And, you know, all these enlarged, twisted veins are all wrapping everywhere, and we're having trouble finding one of your fallopian tubes. One of them looks shredded, and the one ovary has definitely got some kind of lumps in it. And, yeah, it's not looking very good, my lovely. I know. Yeah, I think we do have some scarring on the go as well, which is on your bowel area, okay, and around there, but we need to remove what's going on. I know. I know. But the stage that it's at, you would probably need to have a hysterectomy. Yeah, I know, my lovely. Okay, all right. I know. I just let you process that for a moment. Okay. All right, my lovely. I'll get you a tissue, okay? I know. Here we go. It's never easy to say. I mean, I don't see this a lot, okay? But it's, yeah, I'm glad we've done it today. I really am, yeah. I mean, you could have left it. I could have done you a laparoscopy, and to be honest, I still could have missed it doing the laparoscopy. Yeah, it can be easily missed. So I'm glad we did this, but yeah. Yeah, so we can't actually cure the condition, but the way that we stop it and like end it is by having a hysterectomy. Especially at the stage that you're at and your symptoms, and that it's something that we do need to look at, I'm afraid. There is a lot there and too much for me to just remove. You know, and all that going on with the other organs there is very complicated. Okay. All right, my love. I know, I'm so sorry. But, you know, I'm going to write all this up in a report. I'm going to give you copies of your scans and things like that. I don't normally do that, but I will do that for you. Okay. And I will send you over as well all the information about your condition. Also about adhesionologists, because I do think you have some adhesions dotted around, okay? I'm going to send you some information about that, and I'm going to send you an information over about the hysterectomy. So it will have to be a TAHBSO, which is literally everything out. Now it's up to you whether you would like to keep your cervix or not. Personally, I would recommend you removing it and having a cuff instead, to save you from, you know, having to worry about smears and things like that. Yeah? Okay. Now, I know it's a lot to process, but we need to get this done sooner rather than later. Okay. But we're going to have to put you on some injections, I'm afraid. If you go ahead with it, we'll have to put you in a chemical menopause. Yeah. And then we can carry out the procedure. All right. Yeah. You'll be in about 3 days. Maybe 4. Okay. So you'd have a cut right away across, and everything will be removed. I know. All right. You did think something like that. Okay. All right. Okay, my lovely. I'm sorry it wasn't any better news, but I'm glad that you've managed to get it all done today. All right. So if you are wanting to start it, then we can get you in for the injection. And then you need to have that for about 3 months. Then you could come in to do the surgery, and I'll be performing that with my team. They are fantastic. Okay. All right, my lovely. I'll let you have a think about it, okay? And any questions, please just ring me. All right, and I'll do my best to, you know, speak to you when I can. If you do want to go ahead, your doctor's surgery will be giving you the injections, okay, my love? All right, and then you'll get, like, come in for your pre-op and then the op and things like that. Okay, my lovely. Yeah. Exactly that. All right. You are very, very welcome, my lovely. And I'm really sorry. Okay. I'm sorry it couldn't be better news, but your life will be completely turned around when you've had it. After the recovery, yeah, you will think it's the best thing you've ever had done. I promise you that. All right. I'm very, very good at my job. Trust me. You scar, you won't even notice it. All right. Okay. Well, I will see you soon. It's been a pleasure meeting you, and I'm sorry that you've been here so long today, but I really do appreciate it. Okay, and I wish you all the best, and I'll see you soon. You take care now. Bye bye.